Welcome, everybody, to Live with Dr. Carolyn Dean. Carolyn is amazing. She's a doctor, she's a naturopath, she's an herbalist, she's an acupuncturist. She's going to tell you exactly what she would do if she were in your shoes. I can't think of a person who has devoted more time to helping people's health than Dr. Carolyn Dean. She can make a huge difference as you listen to her words of wisdom. We know she's ahead of time because she is the doctor of the future. Welcome, Dr. Carolyn Dean.
Hello, Yay! Dr. Ginny. Hello, Dr. Ginny.
Dr. Ginny. Oh my God. That's the last thing I need to be. I rely on Dr. Carolyn Dean for all my health information, and that's about as far as I want to take it. But welcome, everybody, and you too can rely on Dr. Carolyn Dean, as we've all been doing for so many years. And you know what? You don't even know you've been relying on Dr. Carolyn Dean. That's what I'm going to tell you, because as the author of the Magnesium Miracle, she's taught the whole world about magnesium supplementation. Every quote you see online is from Carolyn, her work, her books, and her insistence that magnesium is the missing link to total health. And of course, the thing that you want to prioritize in your supplementation and in your food intake, but mostly in your supplementation, because it's hard to get the amount of magnesium you need from your food. And we're so happy to have you here joining us this evening. And we're going to talk about Dr. Dean's books, her blogs, her library, and of course, her comments and thoughts on today's medical news. So we want you to enjoy the show. Feel free to use the chat line and drop your questions to us. We're here on Facebook. We're also on X, of course, at drcarolyndean.com. And then, of course, we're on YouTube, our Steady Eddie partner. So, Carolyn, off we go. What shall we chitty chat about this evening first?
Oh, yes. Let's chat about my boutonniere. I once again have Aviala's beautiful little clip-on for your hair or for your clothes. I don't wear them in my hair. I don't have enough hair. But Aviala is at urban-n-island. And she does all kinds of wonderful things. So check her out. And I think, did I one time, Ginny, when I came to the warehouse, I brought everybody a bouquet like this or something.
You have brought many, many gifts to the warehouse, but I think we missed Aviella. So we'll look forward to seeing it the next time you come.
Okay. Well, I did it the wrong way. So that's my most important thing of today. And I wore my tropical top because I just realized it's October over there. You guys are going into the fall and winter.
Yeah.
And here I am living in tropical country, so blessed. And I just thank everybody and everything and God and nature for putting me here so I could stay healthy, so I could keep just yakking away and telling people what I've been telling them for 50 years. Right, Ginny?
Absolutely. More than 50 years, I think we discover, but we try not to push the needle too far because it's actually unbelievably amazing that you're still doing it after 50 years. So we're so grateful to have you here. And I agree completely. I think God, nature, whoever put you there, universe, or, I don't know, you could have created the opportunity yourself.
We are a simulation, apparently.
Oh, yes. That's my newest piece of information, too. We're living in a simulation. Yay!
Crazy. So then we go on to our library. And I think we're still talking about the missing link to total health. It'll be backwards on the screen there. But out of that, the blog this week is about calcium channel blockers and magnesium. You can find it at drcarolyndean.com. So, I mean, this is a pretty important topic. I might go into some depth about it because heart disease, it turns out, is at the top of the list of killers worldwide. And your doctor doesn't understand the many processes in the body that rely on magnesium for the heart to function properly. And then there are the arteries and the atherosclerosis, and that requires vitamin C. So,
Mm.
two forgotten nutrients, or I don't know if it's so much forgotten as
Pigeonholed, pigeonholed,
pigeon.
because magnesium is pigeonholed as a laxative, magnesium citrate or whatever. And then vitamin C, totally pigeonholed. Take it for a cold,
Yeah,
pigeonholed.
pigeonholed. And it's horrible because then we become the little pigeon stuck in this little bubble of, well, all you can do for your heart is take these drugs. And these calcium channel blockers, I can't tell you how many times I'm hearing people talking about, oh, calcium does this and it's important for the muscles. I'll get to that in the going over a critique of the research. But what happens is in a heart cell, magnesium opens up a calcium channel, allows a little bit of calcium to go in to create the action, the heart pumping, the heartbeat. And then magnesium pulls the calcium out and it shuts the cell. If you don't have magnesium to open and shut that ion channel, the cell just collects a whole bunch of calcium, gets all excitable, excites itself to death, and it dies.
Hmm.
So allopathic medicine knows that on some level. They know that the calcium channel has to be blocked. So they give you drugs. And I'm just telling you here that magnesium is what's required to open and close that calcium door. So with this calcium channel blocker, then you do get the side effects of dizziness, fainting, headache, fatigue, chest pain, fast and irregular heartbeats. What you think you're taking the drug for are the side effects, because what it's doing is interfering with the magnesium in the body. It's depleting magnesium. So those symptoms are maybe for the most part magnesium deficiency symptoms. And as calcium channel blockers lower the amount of calcium that gain access to your heart, less calcium then means less activity of the heart muscle, slows down the heart rate, relaxes and widens the blood vessel, lowering blood pressure and supposedly reducing chest pain. But then the calcium itself, if there's too much in the cells, it's going to cause more constriction, contractions, irregular heartbeats. So it's this delicate balance that allopathic medicine thinks they can just shove a drug into a person and things will work out. Whereas we know if you take the right amount and the right kind of magnesium, the body will take care of things. And the right kind, of course, is our picometer magnesium. So the other thing about this calcium business is we're never told why we may have excess calcium that needs to be blocked, and that's because we have too little magnesium. Because what magnesium will do, it will solubilize this dense calcium, put it into the bones and teeth, and keep it out of the soft tissues, keep it out of building up on cholesterol band-aids in the arteries, or keep it away from breast tissue calcification, heel spurs, kidney stones. It will solubilize the calcium. So, yeah, if doctors studied magnesium at all, they wouldn't have to invent calcium channel blockers, because magnesium, it's even been called by researchers a natural calcium channel blocker. So, I told you about how it goes in, it does its work, it's supposed to come back out. And if we don't have magnesium, that doesn't happen. And unfortunately, when researchers talk about calcium getting into cells or getting into mitochondria, they leave out the part about magnesium, that magnesium is necessary for the final production of ATP in the Krebs cycle in the mitochondria. ATP energy molecules is not just ATP, it's ATP-MG. Knowing that too much calcium in the cells can cause problems, medical research developed the calcium channel blockers in 1970. I think they discovered the calcium channels in 1967 or 66. So right away, they wanted to manipulate them. So magnesium is naturally designed to block too much calcium from entering the cells. It follows logically that if someone is experiencing symptoms of heart disease like chest pain, high blood pressure, arrhythmia, that it's occurring because of an imbalance of calcium and magnesium. But doctors don't talk about calcium magnesium when they hear about heart pain, high blood pressure, and arrhythmia, because they have a prescription pad to offer the calcium channel blockers, and because they never learned about minerals in medical school. They just learned about calcium to start pushing it on women over age 40, 45 to protect their bones. And that led to the increase in heart disease in women because it caused soft tissue calcification. And doctors certainly are not aware that calcium channel blocking drugs drain the body of magnesium, making their patients even more vulnerable to heart problems. So in the article, the blog, you'll see at drcarolyndean.com, I talk about vitamin C and magnesium, potassium, which is a close cousin to magnesium. They work together. And omega-3 fatty acids are important to make our cell membranes impervious to toxins and the leaky gut business that helps absorb toxins through the gut. And methylated B vitamins are also very important in heart health. And the best way to proceed in supporting your heart health is to call our customer experience team to help build a healthy protocol. I think one of the things our customer experience people do is they say, well, look at your magnesium and your potassium, look at your vitamin C, your omega-3s, and the B vitamins in our Realign. That gives you a grounding of what you need. You don't necessarily need the coenzyme Q10s and the L-carnosine, L-carnitine, the NAC, all these extraneous supplements came into the mix when people weren't taking enough well-absorbed magnesium. If you have well-absorbed magnesium, you're not having symptoms and you don't go running off trying, dozens of other expensive nutrients. Just this handful that you need because they're food-based, organic, the picometer stabilized ions of our minerals are superior to any other dietary supplement. So that's what I have for the blog today, Jenny. Over to you.
Outstanding. Well, I'll tell you that fostered quite a conversation and a few comments on our chat line. And of course, anybody who's listening, I hope you got the aha that a calcium channel blocker is not magnesium. I mean, you just need magnesium. It's so simple. It is shocking. And it's probably offensive. Now, our wonderful Michelle, who is with us tonight, says, my mother just started a calcium channel blocker because she was having atrial flutter. And it made her head feel pressurized. So she stopped taking it. I've got her on a teaspoon of Remag and Remite, and I'm trying to get her dose higher.
Yeah. That's excellent. You just have to be sure that the taste is, compatible, because people just go crazy. Oh, it tastes terrible. So you put it in some juice, or like I talk about every once in a while, Zevia soda, Pellegrino and Zevia lemon juice. Just dress it up, make it fancy so that people will accept it. And that's a helpful hack. Thank you, Rachel.
That's right. That's right. Now, Donna asked, what is your take on beta blockers? And what would you say is the best diet for somebody with high blood pressure?
So beta blockers, I remember a UK study years ago where they put people who were going into surgery on beta blockers because during surgery, a lot of the inhaled anesthetics are fluoride drugs.
Mm,
Fluoride will bind with magnesium, and you'll wake up with magnesium deficiency, atrial fibrillation, skipping heartbeats, and
mm,
high heart rate. It's a nature probably of the stress as well,
mm,
but the nature of surgery is it diminishes your magnesium. Really smart surgeons back in the day in the 1980s, they were putting their patients on IV magnesium drips during surgery. That's all gone by the wayside.
mm,
So they put a huge group of people on beta blockers prior to surgery to see if they could stop the heart reactions post-surgical. And they had a lot of problems, a lot of side effects, even deaths. So
mm.
they pulled back. But that was UK research. I don't know if anybody reads British research, but they didn't really look at it here. I'm not fond of beta blockers at all. A lot of people have side effects, and it seems magnesium and potassium are helpful. We can't really say too much more than that because we can't really name our products too much because the FDA goes crazy that we're making health claims where we're just talking common sense. And what did you say about treatment or diet for hypertension? What
Yes.
was Well, hypertension, that will happen when the arteries tighten up because the smooth muscles on the inside of the artery walls are magnesium deficient and they cramp up. So
Mm,
the arteries just, instead of being a nice smooth passage, they just cramp up and they increase the pressure, the back pressure to your heart or through your arteries. And what's happened lately, I started seeing things on X that said, oh, the American Heart Association is now saying that high blood pressure is anything above 120. No, it was 110 over 70 because they're having such a terrible time controlling high blood pressure with all their drugs. They're saying, well, maybe if we go after it at lower and lower blood pressures. And what they're doing is giving people drugs way too early, causing more magnesium deficiency because these drugs, some of them are diuretics and you urinate out your minerals. So if hypertension, part of it can be this tightening of the arterial walls because of magnesium deficiency, then you need magnesium. You also need potassium. You also need to look at the stress in your life. In total biology, they talk about our blood vessels are like the the highway to our outside world. And if our outside world, such as our work or our school, is stressful, then the arteries will tighten up. So there's the stress component as well that you have to be even just be aware of it can de-stress you, can slow things down. But you can do breathing exercises. There's so many different breathing exercises, like 2 quick breaths in and 2 seconds exhale. Simple breath exercises can be equivalent to meditation. So in terms of diet and hypertension, it's all the things that maybe affect the cell membranes, and that would be using refined vegetable oils instead of your omega-3 fatty acids, because that's what you need for for your cell membranes. If you make your cell membranes of vegetable oils, they're more porous. They're not indestructible like omega-3s. So there are those things to be done. I think you can read about some of that in the Missing Link book. The bigger book, what is it? The Magnesium Miracle, has more information. It's 600 pages. That's why I wrote this book, because it's only about 200 pages and big print. All my articles, I have webinars online. You can just search my name and a topic, and often something will come up. There used to be a lot more. I used to have hundreds of articles before the FDA shut us down and told us I couldn't be talking about my products by name, because it meant I was making health claims. So that's why I appreciate people being here, listening, spreading the information. You can go online, go on X and YouTube, and respond to people when they're saying stuff that is not true. And when well, a bit of magnesium would help here, do it. Be active. Right, Ginny? Here she comes.
Yeah, that's exactly correct, Carolyn. And we have very active, wonderful customers. Donna said she's been totally stressed out. So I think you hit the nail on the head with that. And all the information about blood pressure is good, because no matter who you are these days, you've got it. They're after you. They want you to do something, take something, eat their pills. And if you just relax a little bit about it, you'll probably be all right. And take your Remag. That's what I always do. Just take your Remag. You'll be all right. Okay. What's next, Carolyn?
Questions and comments. The Missing Link to Total Health that I've shown you twice now, and we've had a couple of reviews, and someone says, I was not aware of the importance of magnesium until I read this book. Well written and researched. Thank you, Dr. Dean. And the other one, very eye-opening to see how many issues are caused by magnesium deficiency. I started taking picometer magnesium, and within 2 months, my brain fog has cleared. So that's awesome. And brain fog clearing, that can be where magnesium is acting as a detoxifier. It's 80% of known metabolic functions. So it's going to be clearing out your cells. It's going to be supporting liver detoxification and all the rest of it, lymphatic detoxification. So that's a place to start. So that's the questions and answers. And now we have pros and cons of supplements, drugs, and research. I don't have too much today. Last week, I think I had 8 points, but my little buddy, Dr. Nick Norwich, he's a PhD and MD. This is not a study, Rachel. This is pros and cons of supplements, drugs, and research. So Nick, he's only 29. He's got a PhD and an MD, and he's so bright. And he looks at studies kind of like I look at studies, but he looks at them through drugs and surgery and common sense bias. I look at them through drugs and surgery and nutrients. So I'm always catching him up on what he's missing. And right now I'm preparing a longevity webinar for my local talk here in Maui. So I was listening to him talking about aging and how healthy muscles are necessary for anti-aging strategy. So he said, muscles rely on calcium entering into mitochondria for several critical functions of muscles. So he didn't go any further. So he just put, okay, this is what calcium is doing. It's going to help your muscles, take calcium. So I looked into it because I know calcium can't enter into muscle cells unless magnesium opens the door. And Nick did not mention magnesium in any part of his talk about aging. And I could talk about how Magnesium prevents the telomeres, the ends of chromosome, from fraying as we age. It keeps those telomeres tight. So back to muscles. What does calcium do for muscles? It regulates ATP production, said this online source. Okay, fine, regulates ATP production. But ATP production relies more on magnesium. It's ATP-Mg. How can they leave magnesium out of the equation? And they say calcium is responsible for excitation and contraction. Okay, fine. But magnesium does the relaxing phase of an activity. You tighten up and you relax. You tighten up and relax. If we just left it to calcium, exciting, contracting, then you kill the cell. So they left out magnesium. And the muscle contraction function, yes, like I said, magnesium is necessary to pull the calcium out and not have sustained muscle contraction. Calcium is necessary for muscle repair, so is magnesium. Necessary for cell signaling, so is magnesium. So this reference online that I searched is probably just an AI Google, said the precise control of mitochondrial calcium levels is vital for the muscle health and function, and disruption in calcium handling can lead to muscle damage and atrophy. So what regulates calcium is magnesium. It allows calcium to do its work. So, and I've said many times, I'll say again, medical education doesn't cover nutrients. So no matter how smart some of these doctors are, they don't have those basics. They miss the big picture. Ginny mentioned last week about the doctors that did our Purdue study. They didn't have any magnesium researchers on staff. So we had to go with calcium researchers, and they were blown away when they learned at a magnesium conference at the NIH. It was in 2019, Ginny. And they had no idea how much magnesium was involved with calcium metabolism. They were living their lives in a calcium bubble, and they just didn't even consider magnesium. So you don't know what you don't know until you know it. Right, Ginny?
That's exactly correct. That is exactly correct, Carolyn.
Yeah.
Exactly. Yeah.
And that's the trouble. You tried. Every once in a while I'll throw something on X when I read a whole bunch of stuff about calcium, or I'll read about leaky gut, and I'll say, well, you're forgetting yeast overgrowth, and I'll just put these things in. I don't know if it lands anywhere, but maybe like the layers of an onion, I'll just keep layering it on so that, oh yeah, maybe I should look into that. What's this about magnesium? And I had a great podcast this morning with a young woman. She's a health consultant. She focuses on thyroid, and she's very into minerals. She knows about the minerals that are necessary for the thyroid. She didn't know there were 9, but she was blown away by the information that you can get in our multiple mineral. You can get 9 minerals that are necessary for thyroid hormone production in a picometer size stabilized ion form. Because everybody knows that, or we should know that a magnesium compound like a calcium carbonate, it's not going to get into cells unless it disassociates and becomes a calcium ion or the carbonate ion. And it happens so infinitesimally that a lot of calcium is not absorbed into the cells. So it starts precipitating in soft tissue. Mm-hmm. So this is where people say, well, I don't know how much minerals I can take, they'll build up. Well, our minerals don't build up. We use low dose minerals, that's for sure, because they're so well absorbed. But, somehow we have to be able to get across the the incredible breakthrough that our minerals have made in the mineral world. But then again, I don't want to get so splashy that the FDA comes after us again because we're helping too many people.
Well, I'd be willing to take that risk because I'd like to help a lot of people, and I don't think that there's anything wrong with putting 9 minerals together to help, the thyroid. So we'll have to just keep pressing along. But we do want our customers to know and to share the information because, like you said, she was amazed to learn this. And people know a little bit about a few things, but they don't know the big picture. Once they get the big picture, it's hard to deny the value and the importance of the products that we represent too.
Yeah, and she said herself, I've been working with the thyroid and known about minerals for years, but this is so important. And maybe on the chat, people could say, what do you understand about our picometer size stabilized ions? How can we say it more, I don't know, simply? Is there a way to simplify it? They're not atoms. And I keep saying they're not compounds. They're the element. The element of magnesium is in a picometer size, and it's stabilized like that in a bottle. When we did our Purdue studies, and they put a laser through our liquid Remag, it didn't bounce off any substance because it's in the picometer size. So we know it's there and it's stable because those bottles were probably 6 months to a year old. So it was stable that whole time. And when our human subjects took one dose of it, 1 teaspoon, 300 milligrams, within the 1 to 2 hour blood testing time, they had high levels of ionized magnesium in their blood, which is the form of magnesium that the cells will absorb. So anytime you take an ionized magnesium test of anybody, whether they've taken magnesium or not, from the diet, maybe from low dose magnesium, multiple minerals that they're taking, they will have some level of ionized magnesium. It's just what's in the body. But what we're doing with our Remag is giving people higher doses so that the cells can absorb them. I don't know. Am I talking myself into a corner or am I in a bubble? Which is it?
Well, I don't think you're either. I think you're giving a very accurate and acute expression of what we do have, which, would be a metaphor, something like lock and key. They fit together. A stabilized ion of magnesium fits in the cells, period. It doesn't bump up against it or blow past it. And it's readily available. And Michelle said, I tell people Remag is 100% absorbed and the others aren't. And I think that's a very good thing. This specific kind of magnesium gets 100% in the cells, but the others don't. And I think that's a very good way of saying it. And we thank you for being in the trenches with us to define it, because it is important that people understand what it is.
Yeah, and I have trouble saying 100% absorbed because some, science person will say, well, prove it. So I say fully absorbed, but a lay person definitely say 100% absorbed, because that's what we experience. I mean, we have people who look at the label and say, oh, a quarter teaspoon, okay. And they won't read any further that they can increase it. And they're on a quarter teaspoon, which is 75 milligrams of Remag, and they're just jumping around so happy because they feel good. And if they do call customer service, well, why don't you increase it? You might feel even better. So on a quarter teaspoon, people are over the moon. So that's incredible.
Yeah, absolutely. Now, Donna is asking a very good question. She said, I heard that some of the minerals compete with each other and make one or more of them neutral or unavailable. Is that such a thing, or is that a myth?
It's kind of a myth. I think that started when chemists start playing with mineral compounds. the way I describe what's going on there is you can take vegetables, and in a vegetable you can find, dozens of minerals. In sea salt there are 72 minerals. So there's a lot of minerals. That's why we tell people to put a colored sea salt in their drinking water. So if there are all these minerals in vegetables, well, are they fighting against one another? Would God and nature create that antagonism? So that's the way I discuss taking all your minerals together is totally appropriate. Now, I know there are mineral wheels. Well, there's some antagonism here and there. Well, calcium and magnesium are antagonistic. But what it is magnesium solubilizes calcium and puts it into the bones. Zinc and copper can be antagonistic, but that's when you take high doses of zinc and you bump off your copper. What we work with is low potency minerals that work together. So that's how I'll answer that question.
Excellent. Excellent response. Excellent. Thank you. Now, back to blood pressure. One of our listeners tonight is asking, what do you feel is a good blood pressure for reading for women over 70? And I guess I would ask, why would 70 make a difference?
Well, what happens, what I learned when I was in med school in the mid 70s was as you get older, your blood vessels maybe get a little more rigid and you need a higher blood pressure to keep your blood going to your brain. So that meant to me that an older person might need like a 140/90 blood pressure, but that just gets knocked on its can because they want you to be 110/70, 120/80. But we know for a fact that when people with higher blood pressure, say 160/90, are put on blood pressure drugs and they're dropped down to 120/80, they can get dizzy, and that can be from low blood pressure. The blood not getting to their brain, they get dizzy, they fall over, break a hip, and end up in hospital. So I guess what I would say is, even like I'm in my mid 70s and my blood pressure is perfect because I take enough magnesium to keep my blood vessels flexible. Elastin is necessary for good flexible arteries. Collagen is necessary. So I'm on my 8 to 10 grams of vitamin C. So I'm keeping my blood vessels flexible so my blood pressure is what it has always been. So that's the rationale for higher blood pressure in the elderly as their arteries get rigid. We create flexible arteries.
Very good. Oh, excellent. Wow, that's a good one. Now, Karen's asking, I wonder how long the liquid is stable. I've had some bottles for over 2 years, and I just want to say that we've completed our stability studies for the products.
Yes.
And that was last year. And we have a 4-year shelf life on Remag. Now, that shelf life was established by looking at products that were 4 years old. So no matter if your products are even 2 years old, you've got a 4-year shelf life in your products, even if they're not labeled as such, but our newer ones are labeled that way. So, think about how ancient our minerals and how long they're going to stay stable is, just forever. Once they get in that state, they're there. So you can't take them out, which is the whole point, that it won't change in your body either. It's going straight for its destination. No stopping.
Right. Yeah. The 18-step process that creates these stabilized ions it's been proven, as Ginny said, we could do a 10-year stability test and probably pass it, but we've gone for the 4 years right now. So that's awesome.
Very good. All righty. Thank you, everybody, for your great questions tonight. Lots of engagement. Michelle says, whenever you're talking about the products, keep it simple. You don't want to lose people, and we agree. But we do have doctors that we have to describe it to, and they're scientists, and they can hang on for the deep talk. So we're fortunate that way as well. Now, Diana Orlando asked this earlier, and I'm kind of waiting for her to respond to my question. So, Diana, please look for that. She's asking about what products to take for osteoporosis. She's a longstanding customer. She takes all of our formulas. She takes Remag, Remite. She takes Pico Potassium, D3K2. And I just want to confirm, Diana, that you're seeing improvement in your osteoporosis claim that your doctor's trying to claim for you as you're using the formulas. But I think you're on track, right, Carolyn? Do you think she's looking for any other supplementation?
Well, it could be the amounts, call customer service and find out if you're on the average to above average amounts for osteoporosis. The thing about osteoporosis is they decide it on a DEXA scan, and they compare our 70-year-old bones to 30-year-old bones. So yeah, they're going to be different. And this is why it's important as we continue on in life to get our muscles in gear. We cannot stop moving. As I've talked about my muscles with my little 3-pound weight, 3-pound weight, I trade hands and I build my arms, and I swim and walk for my legs. And I'm starting to do planks and push-ups because I want to keep up with RFK Jr. and Pete Hegseth. We have to keep our muscles in gear, and it's our muscles that support our bones more and more as we age, because there's going to be some shift because our estrogen is low. Estrogen builds bones, but we don't need calcium to build bones, and we don't necessarily need estrogen to build bones. We can support our bones with our muscles and with our Remag, Remite, Pico Potassium, vitamin D, D3K2. The K2 part of the D3 directs calcium into the bones, and D3 won't work if you don't have enough magnesium. So they all work together in a very heartfelt way. Yay. Just waiting on Jenny. There she is.
There I am. There's too many people touching all the boxes on the chat line. So let me get through some of these things.
Okay.
Susan's saying, what toxin could possibly block Remag from getting into the cells, like glyphosate? So do you think there's something that can prevent Remag from getting where it wants to go?
I don't think so. I mean, magnesium, I think it's on the periodic table is at 12. It's tiny. It's just going to go into its allotted channel. Glyphosate, I've never heard that it binds magnesium, but I wonder if that's a possibility. But all these toxins, I mean, they are everywhere, but we have to be aware that our body detoxifies. We have our glutathione, and we have the methionine and realign. That's the precursor to glutathione. Magnesium is necessary in glutathione production. We have the methylated Bs that help methyl detoxification in the liver. We have the sulfur amino acids in realign, the methionine and taurine sulfur. We have covered the waterfront for helping to detoxify. Even the Wi-Fi business. What Wi-Fi does is it interferes with the gated calcium channels. They call them gated calcium channels. Well, those are regulated by magnesium. So if you have enough magnesium, and enough meaning you may need 2 teaspoons a day, and you take it throughout the day, You don't take it all at once, which could cause a laxative effect. So if you have enough magnesium, you're not going to be bothered by the Wi-Fi that's, going through everybody's brain as we're speaking. We have created, a culture that has so much technology that our bodies weren't meant to even survive, I would think. I remember back in the 80s in my practice, that's when the chronic fatigue started, and people started being allergic to everything, and people were running out to the wilderness to try to survive. We had a wonderful customer service person, Jackie, who lived in the woods by a spring to try to survive, and she was in some meditation near some meditation group, and someone gave her my book on magnesium, and she started to get involved, and she started working for us as she became as healthy as anybody else. So and she said that it was the Wi-Fi and everything that was affecting her. So we know people can turn around. We know we can adapt and survive. Adapt, adopt, and survive, something like that. But you have to have a protocol, and we have the protocol. And you can't just dip your toe in and say, well, I didn't like the taste of it. I think I'll go off to some Ayurvedic place and take their non-organic herbs. You've got to stick with something that hopefully you trust and something that we know works.
Very good. Excellent. And also, I think that you're confirming what the basis of the question, which was Remag's a detox agent, right, Carolyn?
Absolutely. Absolutely. After 2 or 3 months of just taking good amounts of Remag, people will start detoxing their yeast overgrowth. We see that all the time. And then we say, oh, good work. Let's put you on our yeast formulas, and then you'll feel even better. But before that, people their immune systems are so burdened that if you put someone on a big yeast detox with lots of herbs and all the stuff that I used to use, and it never worked, then they can have Herxheimer reactions, which is die off toxins from the dying yeast. But in our formulation, our silver, it seems to neutralize the Herxheimer reaction, so you don't feel bad when you're on a yeast program. And the silver is all in the picometer form, is also antifungal, antiviral, antibacterial, and it doesn't kill off good bacteria. Like even oregano oil will kill off good bacteria. And our antifungal, the Flora Revive, Saccharomyces boulardii, very gentle. It's a yeast itself that crowds out Candida albicans, and it's so gentle that it's used to treat childhood diarrhea. And we also put in humic fulvic. Some people just use humic fulvic for their yeast, but we add we create a complex, not a complex, but a combined formula. It saves people money, but I think there's a synergism. Humic fulvic, that's the humus from a century ago that they dig up deep in the ground. So it's all the leaves that have decomposed, and the soil. So it's got probiotics, it's got spore probiotics, it's got prebiotics, it's got all the minerals. It's got the minerals from the plants that used to be mineralized. Now our soil is pretty empty of minerals, and it's got a certain pH balance. So humic fulvic is awesome. There are whole companies that just sell humic fulvic. So that's our yeast treatment.
Very good. Excellent. And also, when it comes to the yeast treatment, I wanted to ask you, what is your treatment for parasites? Aren't parasites different than yeast?
Well, parasites are predators, and they will take hold in a weak environment.
Ah,
This is where maybe we should talk more about our RNA drops, but the only study I have with our drops is it's a barley germinated barley seed germination. It's in a great big round vats. It's circulated for a few days. It turns into a liquid, and those drops we sell. And the straw from the barley, we never threw it out. And all of a sudden we realized it was great fertilizer. We did a radish study here on a farm. I put all my resources into a 46-acre biodynamic organic farm. We planted radishes with our barley straw, and another plot without the straw. After 25 days, we got 85 pounds of radishes off this small plot, and the plot without the barley straw, 3 pounds of radishes that we could sell without being embarrassed. So what happened there is the barley straw, it's like a life force. It has life in it. It had the probiotics, prebiotics, and it gave life force to the radishes that deterred predators. A predator will look for weak organisms and look for weak humans. And that's what my total body meltdown is just a whole weakened immune system, and we just want to build that up. So for people who have a weakened immune system, weakened life force, we talk about the RNA drops, but we don't talk about them enough.
Very good. Excellent. Excellent. Okay, we're almost to the top of the hour, Carolyn, and we've had a very active, vibrant chat line and all kinds of people calling and saying things.
But we have to continue. We have to do some of the articles. I've got something awesome to talk about, Ginny.
Yes, yes, that is true. You've got to talk about your talks. And if we don't get to your questions tonight, again, customer experience team standing by, and they'll answer all your questions. All right, Carolyn, let's go.
Okay, the first study is low-dose radiation improved knee osteoarthritis pain and function in a randomized controlled trial. This, when I looked at this, I thought, who are these clowns? So 6 sessions of low-dose radiation therapy reduced pain and improved physical function in adults with mild to moderate knee osteoarthritis. And they presented this at a American Society for Radiation Oncology. And I asked Rock, well, how does this work? And it said, low-dose radiation suppresses pro-inflammatory cytokines and enhances anti-inflammation by killing off pro-inflammatory cells. So it's killing stuff, and thereby reducing pain signals. So I looked at this low dose. What does that really mean? Patients received 3 gray doses times 6. So it's GRAY, but they say 3 GY. That's how they designate this gray, this assessment of the amount of radiation. So in doing the math, 1 gray equals 1,000 millisieverts, and this is what I thought radiation was measured in. So 3 grays times 1,000 makes 3,000 millisieverts for one knee treatment. So a chest X-ray gives you 0.1 millisieverts. So I'm talking about one treatment on your poor knee, 1,000 millisieverts, chest X-ray 0.1. So to treat knee arthritis, they're giving people 3,000 millisieverts, or the equivalent of 30,000 chest X-rays. 6 sessions is 180,000 chest X-rays. When I asked Rock for the maximum number of chest X-rays that a person could safely take, it said 10,000 in a lifetime, because radiation is accumulative. So they go on in this article, knee osteoarthritis, leading cause of disability, with a persistent treatment gap between conservative care and invasive joint replacement surgery. And conventional pain medications, such as nonsteroidal anti-inflammatories, often have significant side effects with long-term use. So that was their reasoning for radiating your knee. So this treatment gap, well, can fill it with proper physical therapy and dietary changes, with supplementation, with acupuncture, with massage. There's lots to be done. And then ionizing radiation itself, it ionizes atoms, which means it can disrupt molecular bonds and potentially cause damage to living tissue. And just today, I saw a piece of research confirming that radiation therapy, instead of killing cancer cells, can induce metastasis. So ionizing radiation can cause and spread cancer. And they want to put it in people. 180,000 chest x-rays. And the research was funded by Korean Hydro and Nuclear Power Company. So what do you think about that, Ginny?
More fun with research. I mean, it doesn't get any crazier.
No,
Wow.
it's terrible. Just
Wow.
terrible. Now, the next one is diagnosis and treatment of unrecognized spontaneous coronary artery dissection in young women presenting with an acute coronary syndrome. Okay, so what they're saying here is this spontaneous coronary, so coronary artery dissection means a coronary artery, the wall is kind of splitting. And they say it's the cause of most heart attacks in younger women. And it occurs, as I said, when a tear develops in the wall of a coronary artery, allowing blood to seep between the layers of the artery wall, creating a bulge that narrows or blocks blood flow to the heart, leading to symptoms of a heart attack. And they conclude that underdiagnosis in young women is common and leads to inappropriate treatment, highlighting the need for increased awareness and improved diagnostic approaches. But they don't really have a curative treatment, and I don't know how they'll improve their diagnosis. But it's a scary fact that more than 60 million women, about 44% of the US female population, are living with some sort of heart disease. And it's the leading cause of death for women in America. So what does a weak coronary artery make you think of? Vitamin C deficiency. Without enough vitamin C to make collagen, all the connective tissue in the body is weakened. And taking processed collagen powder is not the answer. I talked about that a week or so ago. It's vitamin C and protein, so you can get your own glycine, proline, and hydroxyproline to make your own collagen. And these amino acids are in our restructure and also in animal protein. So there's another vitamin C deficiency condition that will go unrecognized. Oh, these young women, their coronary arteries are splitting. Oh, woe is me. What will we do? We'll never look at vitamin C. That's what's going on. Just a couple more. There's some drug that will help smokers quit smoking. And I can't even pronounce the name of this drug. This cystainocline was effective for smoking cessation in both people with chronic obstructive pulmonary disease and those without, offering hope to people who face greater challenges in quitting smoking. And of course, our experience with our formulas is people will say, I don't feel the need to smoke anymore. I don't feel the need for alcohol or so much sugar or so much coffee. So a healthy lifestyle can really help people. And various of our formulas can help heal up the lungs. So there's the addictive part, and then there's the damage from the smoke. And the next article, smell loss may linger for years after COVID. This impaired sense of smell can persist for years. even when patients recover from their initial illness. New research in JAMA, Journal of the American Medical Association, indicates the study enrolled more than 3,000 people, most of whom had COVID. And what we know about smell and taste is zinc is affected, and we know zinc is what really helps kill the COVID virus. And so in people with zinc deficiency, maybe they developed COVID, and then their zinc deficiency got so bad that it affected their taste and smell. So we start with zinc and bounce that out with the copper. And yeah, Ginny went through that, so I don't know if she'll have something to say there. I think I just have one more, maybe two more articles. But Ginny, do you want to pop in and talk about this sense of smell, and COVID?
Well, what I can say is that it was very scary for me personally, and it wasn't zinc necessarily related because I was pounding so much zinc.
Mm-hmm.
But it did take several months for me to fully recover every smell. They all came back gradually, but I'm very grateful that it all came back perfectly, and now it's probably even better than it
Mm-hmm.
was. So there is a possibility of that, but I'm just going to go with what you said about weak systems. If you're weak and you're not, all your lights aren't on or your battery isn't fully charged, then you're not going to be able to operate all your functions. And I guess I came back stronger, and now my smell is probably better than it's ever been.
Very good. Okay, quickly, where are we? Yeah, we'll go a few more minutes. The next one is the meaningless claims on supplement labels. Now, it really bothered me because now supplement companies are being blamed for labels that the FDA forces us to use. We can't make claims. The name of the product can't imply what it does. So this article, it's a commentary actually, by what's his name? He's a commentator Perry Wilson. I quote him a lot. But it's useless information. What would have been helpful is to tell people to lobby the government to do better when it comes to supporting natural health products and not just be biased toward drugs. So basically, the commentary was a hit job on the supplement industry. The writer Perry starts out saying, there's plenty to complain about in the vitamin and supplement industry: the lack of real regulation, lack of tight manufacturing controls, adulteration, influencers, but deceptive marketing practices, the use of weasel terms like supports heart function really steams my kettle. So he goes on to say that the FDA regulates what companies can put on product labels. There are three main types of claims subject to FDA scrutiny: nutrient claims, saying like low sodium or high fiber; health claims, such as a healthful diet with adequate folate may reduce a woman's risk of having a child with a brain or spinal cord defect. But health claims require scientific studies to back the claim. That's your billion-dollar study. So, and running a clinical trial these days is just too expensive for a supplement company. The third type of claim is structure and function, which is why we have to say helps heart function. So he goes on about that, and what we're forced into doing, he doesn't even acknowledge. And he says it, yeah. And I say it got so bad during COVID, the FDA came to us and said we couldn't even have testimonials on our websites or write about my formulas in my books. So this waste of space article was written because there's a recent study called Label Statements and Perceived Health Benefits of Dietary Supplements, reported in JAMA. So I'm not going to go into it. It's just too boring. But you could go to my book, Death by Modern Medicine, and read the statistics that over 1 million people die annually from unsafe and unnecessary medical intervention. and there's barely any verifiable death from supplements. So at the end, the author has the audacity to say that these supplements are not cheap. And he goes on. And he said, provided you're eating a relatively healthy, diverse diet, most supplements are by and large a waste of money. And what about paying up to $1,400 a month for Ozempic to treat a condition that a good diet and well-rounded supplement program could prevent? So there have never been studies to show what a good supplement program can accomplish. The current research model is to prove that supplements are unnecessary and even harmful. And most of these supplement studies are funded by Big Pharma to defeat the whole just the whole premise of dietary supplements are useful, and also dietary supplements, most of them are synthetic these days. Ours aren't. And the last study, more than a number, sleep quality is the next target for cardiovascular health. And I mean, what I'd say about this is they're urging cardiologists to inquire about sleep habits, but doctors don't even ask about diet. So I doubt if they'll take the time to ask about your sleep. And if they did, what advice would they give? And one of the 7 pillars of my old online wellness program was devoted to sleep. Turn off your Wi-Fi at night. Don't eat or drink late. Wait 3 hours after eating before going to bed. Don't watch the news before bedtime. Write out your to-do list for tomorrow. Pray or meditate and give thanks. And your doctor's not going to have that discussion with you. The best they'll do is give you a sleeping pill or tranquilizer. And the problem is if they say, oh, this person has a sleep problem, oh, and they have a history of heart disease in the family, they'll click it off as another risk factor and put you on statins earlier than they normally would. So that's what happens with all these new risk factors that they're digging up. So that's the end. Ginny, back to you. I can't hear you, Ginny. You're muted.
What Fergie says is lots of great information as always. Thank you, Dr. Dean. Thank you, Ginny, Bob, Dr. Dean, Melody Rose, and everybody at RNA Reset. And that's just the perfect summary of all things. And we just absolutely love Fergie, and we're sending everybody hearts. Mm-hmm. If you want to find Carolyn, you know to go to drcarolyndean.com. If you're looking for the formulas, you've got to go to rnareset.com. And of course, if you want to help your pets, you've got to go to picopets.com. And all those different places you can scurry around and get everything together for yourself and improve your wellness and share this with your friends and family. So thank you so much, everybody, for tuning in. And of course, we'll be back next week, right, Carolyn?
Oh, yeah. I mean, where are we going to go?
Yeah.
And we didn't mention the gift. Rachel put it up. We have a gift box now where you can gift the products. And that is so important. Every gift you give should be our formulas, because you'll be saving lives. Seriously, saving lives. It is just crucial. Yeah. Right, Jenny?
100%. Yeah. I can't think of a better gift. Really.
You have been listening to Dr. Carolyn Dean, the doctor of the future. Become a member of drcarolyndean.com and get access to all her leading edge of creation information, as well as archives, webinars, and other valuable media resources. Join Dr. Dean and Ginny Almighty same time again next week.